take on what's happened with Illinois right now, the effort to reopen, close? What are your thoughts about what they're doing right now? It's confusing.
I think we should all understand that in January, February, and March, the information available was pretty confusing. China was not being completely honest. We didn't have good data. We didn't have testing. The CDC, the Center for Disease Control, made some big mistakes on developing a test that turned out not to work. We had a little bit of chaos. So I give everybody, across the country from the White House to the State House, a fair amount of credit for adjusting and listening to experts. But as things have become clear that this is not going to kill 5 million Americans, that this is not an infectious disease which is going to hit people on a broad way, I think there's been a real slowness to address what the experts are learning. We now know that for the most part, the coronavirus is not a serious risk as long as you're not over the age of 60 and generally comorbid, if you don't have other complicating conditions. So that being true, we should be focused on people over the age of 60 and people with comorbidities or other health conditions, and we should be doing everything we can to safeguard them, okay? And then letting the rest of society get back to work and get back to school and get on with their lives. We're doing them no favor delaying the broadening of the virus. And the hope for a vaccine is kind of a glimmer. There, I think, have been 8 different COVID infections from SARS to MERS to now COVID-19 that have kind of swept across the globe over the last 30 years. There has never been a vaccine developed for any of them. It's a very difficult thing to develop a vaccine for a fast mutating virus. Now, maybe we get lucky this time, but whether you're a governor pinning your hopes on that, or you're a secretary of health that's misleading the public about how many people have passed, or you're a medical director who's now classifying heart attacks as COVID because the hospital gets paid more, there's an awful lot of misinformation now that I think is slowing down the reopening of the economy, that's hurting families and hurting jobs and hurting companies unnecessarily. We've paid an awful price, probably around $5 trillion for reacting to COVID the way we have, and we don't need to make that any worse by spending the summer navel gazing, hoping that we can protect everyone. It's a lie. It's a misleading and unfair lie for government to pretend they can protect you. That most of the deaths in the United States have taken place in nursing homes, which are regulated by state government, which are licensed by state government, and for the most part paid for by state government. So where they have almost complete control is where the highest death rate has been. I mean, this is a horrible virus, just like polio was horrible, just like the seasonal flu can be horrible, just like the next virus may be horrible. But just like the old story about the child in the bubble, I mean, what our best defense against COVID is our immune system. Okay, let us get on about our business and do the right things, and let's protect the really fragile, support our frontline workers, rethink our PPE so that our personal protective equipment is made in the United States and we never again have to beg the communists in China to send us masks and gowns. That's how we come out of this. Stronger, I hope, and wiser.
But it's going to take a while. I mean, it took us a while to get after 2008, 2009. We're just recovering from that to have this happen. It's been...
Yeah, the real question is how much stored demand there is. But the most important thing is that we have got to learn politically from this, that scaring people and body counts and police actions are not the way for a free people to deal with an epidemic. So hopefully the voters, as we come out of this and we understand that the fatality rate is extraordinarily low on this, lower probably than seasonal flu, as we understand that there were always enough respirators, that when Cuomo in New York was calling for 30,000 new respirators, he was sitting with over 8,000 in a warehouse. That when they were crying for PPE in Chicago, there was more than 1 million gowns and 2 million masks in a warehouse that was controlled by the City of Chicago Public Health Department. I mean, it just has been the wrong approach. Next time, okay, we need to listen to the scientists and we need to judge their information, not blindly follow it. But we've got to make sure we're better politically prepared to lead through these things. I mean, to me, it's an embarrassment between the fumbling at times of the president and the sophistry and the stupidity of the governors, and then Mayor Lightfoot banning sunshine and closing the beaches, and I mean. Some of the things that have, yes, some of the things that, yeah, church is not essential, but marijuana stores are, liquor stores are. I mean, that is not American. That's not the people we are. And we should never, never let this happen again this way.